Hello, my name is Austin. I've never really made a YouTube video before to like post, but a coworker brought COVID-19 to work again, I think, and um, I'm not tooting my own horn, but I'm really interested in pharmacology and medicine. I've worked in medicine for over 10 years before they stripped me of my license. I got in trouble. But anyway, I just thought I should share some knowledge if anybody has a family member, especially if they're older, that is going through a any type of infection, especially viral though, influenza, COVID, anything like that. There is a really powerful antioxidant called NAC, and it is. I don't. Let me pull up the research. I'm new at this, so bear with me. Um, so this is the clinical research study that was funded by NCBI, I think, or NIH. This is government funded research, and this is a clinical study, the National Library of Medicine. So this proves, and this is regular NAC. So you can get what's called N-acetylcytosine, which is just regular NAC. What I take is NAC ethyl ester. And chemically it's a little bit different, but basically all that means is it allows your body to process it more effectively. So 100 milligrams of NAC ethyl ester is equal to 1,000 milligrams of NAC. And just from the research, and you can pull this up yourself on Google, excuse me. Yeah, like I said, I've never had blood in my sinuses. Like when I blow my nose, it was green and it had blood in it. The only other time that that has happened is when I had COVID. I have not lost my sense of smell yet, but I have already had COVID, so it may be a reduced response this time. I may not be as symptomatic, but I would like to also add, I know that there's a lot of polarization politically with a lot of this stuff, but I did not get the vaccine. I don't think that it's the government's right to impose any type of medical treatment on the U.S. population. And just with my research, I didn't feel safe with it because I was in the age bracket, a male in my 30s. There was a high incidence of pericarditis, myocarditis, and it's really a gene therapy. It's not a vaccine. But if you've gotten the vaccine, it's I'm not demeaning you. I just don't want to be demeaned because I chose not to get it. I've already had COVID, and so my immunity is high. But you can get COVID multiple times. So anyway, so NAC, I just wanted to share this because I felt guilty, like I had this knowledge about this stuff, and I was like, well, damn, like I mean, I would just feel like a pig if I just sat on this shit and I didn't actually at least try to share it because if this actually helps somebody, helps your mother or your father or your sister or anybody, your friend, doctors, I'm not a doctor. I was in nursing school, and actually, I was going to pharmacy school before I got in trouble for selling weed, and that screwed me up. But it's not like I'm a bad guy. I'm just an entrepreneur, and I saw a market opportunity, and I don't think weed should be illegal anyway. So, but it screwed me up, so I didn't go to pharmacy school. But I've always been interested in pharmacology and just neurochemistry and how these things work. So NAC is very, very, very effective in treating. Let me just pull up because I know a lot of people are not going to want to actually read this stuff. So let me just kind of show you some key things because I've already read it. I love this stuff. So, it takes approximately 7 days to develop compromised tomography. So basically, what that means, it takes 7 days for it to really get bad. You might notice symptoms after day, 7 of being exposed, and then it takes a further 2 days to progress to respiratory distress syndrome, which is what actually usually kills people with COVID. What happens really is your body has a natural feedback loops and stuff that try to fight off disease. And so when you get COVID, it kind of, the body doesn't know how to deal with it. And so it kind of goes into hyper overdrive. And what that ends up doing is causing something called cytokine storm. And that can cause acute respiratory distress syndrome, which is what usually will end someone's life with COVID, unfortunately. And even if you're asymptomatic, even if you like are young or whether you're old, it affects people differently. Like I never really had bad symptoms. I lost my sense of smell when I had it in 2021, I think. Now I think I'm getting a test tomorrow before I go to work, and if I do test positive, I'm just not going to go to work. But I will say this: I know it's politicized, but wearing a mask actually does cut down on what's called viral shed. So when you have a virus, you blow your breath out, you can see it when it's cold. You're always releasing that much moisture in your breath, whether you see it or not. And the virus likes to hang out in all those little microscopic water molecules that are coming out of your breath. So, the 6 feet is accurate. Wearing the mask is accurate. It's much more effective if you actually have some type of illness. If you wear the mask, I'm not saying wear it all day. I would not wear a mask all day because it cuts down on your oxygen and increases your carbon dioxide, and that's not good for you long term. But if you're just going in around other people, or if you've got to go to work, get like an N95 mask, or really, I prefer the masks that have an actual inflow and outflow respirator component so that anytime you breathe in, you're actually getting fresh air and then it filters out what you're exhaling so that you're not just sitting there breathing stale, virus laden air in your own mask over and over and over again, because that's not good either. You got to spend a little money and do a little research and get the proper mask if you really want to do it right. But anyway, there's that. Excuse me. But look, you can look through this stuff. I don't want to go too into it, but just trust me when I say so. NAC, N-acetylcytosine, a forgotten immune modulating agent. A lot of these diseases and stuff, there's something called reactive oxygen species. Like if you do, I've done research on like hard drugs, for instance, like something like methamphetamine. It triggers this huge release of catecholamines, and people love it. It feels great. It does all this, it does all that. But what that does is it triggers other feedback loops in your brain, so that when your brain's trying to clean up all this dopamine, and break it down and and the meth itself, it's releasing a bunch of free radicals, and free radicals are these little microscopic particles that are a reaction, type exhausts, you could say, and they just fly through like crazy speeds, like all through your cells and stuff, like an explosion with these little particles going everywhere, and they damage DNA as they fly through it, or they damage other cellular components as they fly through it. What antioxidants do is it's like a molecule that has a magnet, and it can suck those up. So, and it's prevalent in virology too, with viruses and stuff. You can read it for yourself. Like anybody who has a question about this, you're welcome to message. I'll leave the comments open. Like I said, I've never, I'm not somebody that tries to be an influencer or get fame on social media. Like I'm a very private person, but God kind of led me to, as I was researching this for myself again, I felt led to post something, put something out there, and maybe it would help another person, because a lot of these doctors, now don't give up on traditional medicine. I'm not saying that all doctors are quacks, but really it is up to you to have at least a baseline understanding of medicine and, just human anatomy and physiology and your bodily functions. And you have to be your own doctor. You have to gauge them. And it's often very, very effective to at least get a second or third opinion with anything major, whether it's getting a hip replaced, or, a knee replacement, or getting some surgery, or having your appendix out, which the appendix, oh, that's another video I'm going to post. The appendix, my mom had her appendix taken out because it ruptured or something, and it would have killed her if she didn't go to the hospital. Thank God we got her there in time. But ever since she had that thing taken out, she has had nothing but problems. She developed diviculitis at first, and then it turned into diviculosis. And basically, that appendix is like a little safe house for your good bacteria in your gut, and that is, doctors especially, and people don't realize how good bacteria in your colon and your guts actually modulate a lot of your health. So she was having tons of problems. Just a quick snippet, if anybody has dealt with that, what you need to do to treat that is use it's on the tip of my tongue. I've got everything written down. This is, years of research and stuff, so I can't remember everything off the top of my head. But um, I'll post another video for the diviculosis diviculitis because that's very important and a lot. Like I think it's 60% or 70% of people over 60 deal with some sort of complication from that. As you get older, there are natural remedies for this stuff, and I don't know. I don't think necessarily it's purposeful that it's withheld. I don't think it's withheld per se, but doctors, they're part of the medical establishment, and they're trained to treat disease. They have a disease treatment kind of worldview and a spec on this stuff. So they're trained to recognize symptomology and disease and treat it with this or that pharmacologic drug. When they're, I personally, there is a lot of value in that. You kind of, it's not like, oh, I'm homeopathic and, these doctors are all quacks, they'll kill you. It's not like that. You've got to take the best of both worlds. There's a lot of pharmaceutical medicine that is helpful. There are a lot of good doctors out there, but there are some quacks out there, and there are some people that, not intentionally, but, may not give you the best outcome possible because they just don't know any better. Okay. So anyway, this is the research study. I don't want to, I don't want to go all through this. I read the whole thing. It's really interesting, but basically if you get COVID or if you, especially if they're older, this is what you need to look at right here. So you want to do, I do the NAC ethyl ester. If you do NAC ethyl ester, what I'm doing is taking 200 milligrams a day for 5 days. That's 100 milligrams. And the only place I found the NAC ethyl ester, I think, was on Amazon. I don't know how to change it to my camera to show you a picture, but I might go over there and show you in a minute. But you can just get regular NAC. You just take a higher dosage. And NAC, what it does, your body converts it into glutathione. And your body needs glutathione for a lot of functions. It's a powerful antioxidant. It's an anti-inflammatory, natural. Forget the ibuprofen. That shit'll tear up your kidneys. You need to take NAC because it's a natural anti-inflammatory, and your body needs glutathione. A lot of diseases are mediated by and are progressed by a marked reduction in glutathione, especially in elderly people. So this is a glutathione precursor. It'll increase glutathione pretty substantially, pretty quickly. And it's safe. This stuff is safe. You see an advertisement on TV for some drug and it's got like 100 million side effects. You can read the study for yourself. A lot of this stuff doesn't have a ton of side effects because it's all natural. A lot of it are, what is the word? It's late and it's like 1:23 in the morning here. So, I can't think straight now. I might post another video, but this is what you need to know. If you get COVID, if you can get some regular NAC, you want to do about 600 milligrams BID. So 600 milligrams twice a day is what BID stands for. 600 milligrams twice a day. And NAC significantly reduce the levels of TNF and MDA. But I don't want to confuse people. A lot of this stuff, is, I'm medically trained. I was in pharmacy school, so I understand this stuff. But basically the gist of it, look, take two doses a day of 600 milligrams of NAC and do it for 5 to 7 days. It's going to improve your outcomes significantly. Especially, like, it's even been shown, let me go down to here where it shows improve lung function to reduce mortality rate by intravenous NAC. Cytokine storm is a big one. So NAC, you'll see research papers on this all over the place. COVID usually causes respiratory distress syndrome through a mechanism called cytokine storm. Cytokines are your body's natural inflammatory markers. Like if something fucks up in your body, excuse my language too. That's just how I talk. But if something messes up in your body, basically, it creates this situation through oxidation, like I talked about earlier. The free radicals start flying off all over the place, so that your body recognizes, oh, there's a problem there. But when it overreacts, you get something called cytokine storm because you're not supposed to release too many cytokines, or it can create problems. So you get the cytokine storm, then you get respiratory distress syndrome, and then you pass away. So. It's been closely linked with mortality in COVID-19 patients. In addition, Secreting cytokines, neutrophils also produce ROS radicals. ROS are chemically reactive oxygen containing species such as superoxide, peroxides. That's another thing because I did a lot of research on methamphetamine because I take Adderall myself. And it's similar, but it's not quite the same. But it basically, I tell people like, if you do too much meth or too many, amphetamine type drugs, you're basically making hydrogen peroxide in your brain and it eats away at stuff. Like it'll kill dopamine neurons and it's just really, really bad news. So, that's just a little side note. If you enjoy recreational drugs, take some type of antioxidant, whether it be NAC. I like astaxanthin, which is an algal antioxidant. That one I take with milk. Oh, another thing with the NAC, if you do want to do this, it's very safe, but let your doctor know that you were going to do it. If you ever get any type of physician that tries to act like they are God and that they are the ones with the final say and that you're just an idiot and they're the doctor, drop them immediately because they are dangerous for your health. They have a God complex and they are not going to help you. They're either experimenting on you or they are just completely ignorant and moronic, and you need to drop them and get a second, third, or fourth opinion until you find somebody that actually knows what they are talking about. Okay? Anyway, so cytokine storm. Let me go through some of this and try to find you some hit points so that we don't go because this is a lot of stuff, and I know it's some people like, I mean, I even like, I love reading this stuff, but sometimes like I'll get to the end of it and it's like, God, I have a headache. That was so much. But, this is how science is done and how you have to prove things. So, I mean, it's just the way that it looks when it's in like research like this. But this is interesting. A case report revealed that the significance of NAC treatment for a patient with, this is what I wanted to show you. These are the case studies for specific patients. And this isn't going to apply to everybody, but these are good case studies. So a case report revealed the significance of NAC treatment for a patient with septic shock from influenza infection, together with, they did an antiviral, which was a pharmaceutical, oseltamivir, I think is what it's called, intravenous infusion of NAC 100 milligrams per kilogram per day for 3 days rapidly improved the patient relapse after cessation of, that's important. Look, the patient relapsed after they stopped the NAC, the N-acetylcytosine. Like, this stuff is, I don't want to be a conspiracy theorist or anything, but, I just think that, I just think that medicine is full of people that think they know everything and think they're like some god because they're a doctor. I call myself Dr. Haskew. I never got a PhD or a medical doctor or even a osteopathic doctorate, but I call myself a doctor because I know my shit and I have helped multiple family members and I have helped myself, and I hope that this helps somebody because that's all I care about. I don't care about a title. I don't care about a credential. I don't care about what is it even called? Like, I'm not, like when you're high on yourself, basically. I don't care about that. I have this knowledge and I wanted to share it because if not, I'm going to be a pig, basically. So, and I should have done this sooner, but, a lot of this stuff I didn't actually come across until recently. And I've got my own issues. So, I feel bad that I just now am posting this, but look at these case reports, these case studies. This is case reports and clinical trials using NAC to treat COVID-19 patients. A recent case report demonstrated that using low-dose hydroxychloroquine, they jumped all over Trump because they were like, oh, the deep state, I hate to be, but, I'm an independent. I'm not Republican or Democrat. Like, you might see me run for office eventually because what needs to happen is somebody needs to go to Washington and start cleaning house. And I'm talking about changing the laws, getting rid of these corrupt ass revolving door politicians that are just in it for their career. What's that movie where it's like, oh, Zoolander, when he's looking in the little pool and he's like, you're just, an investigatory journalist in your career. That wasn't it, but it was really funny. But it applies, that's what these people care about. And it's sad, but I would have loved to have seen Rand Paul get elected. That's who I wanted to vote for back in 2008. I was alive back then when the GFC happened. Oh, and that's a whole nother can of worms I don't want to get into tonight. But I might start posting more videos. Um, I just did a screen recorder because I wanted to show the actual research. But anyway, I'm getting off on a tangent. So, in another case report, a 64-year-old male COVID-19 patient developed respiratory failure on day 13. This is a good one. Post admission, despite being treated with antibiotics, antiviral, and respiratory support. Together with other treatments, a large dose of 10 to 15 grams, that's a lot though, that's like 10,000 to 15,000 milligrams of NSA inhalation. But see, they did some type of like inhalation infusion, and I don't know how exactly that works with absorption and everything, so I don't think his body absorbed 10 to 15 grams. But that infusion, respiratory inhalation infusion, repeated for 11 days, significantly improved his critical conditions. He was on the verge of death, and this saved his life. Okay? So, this is the study. I'm not going to keep going because I've got to go to bed, but this is the National Library of Medicine, National Center for Biotechnology Information. And this research study is N-acetylcytosine to combat COVID-19 and evidence review. This is evidence based, okay? This ain't conjecture. This ain't somebody getting on a pedestal saying, well, we're looking at hydroxychloroquine, which, they shouldn't have ripped him for that because actually hydroxychloroquine does have positive outcomes for patients. And what kills me is these idiots just politicized it, and they actually took an effective treatment away from people and probably killed people because they just hated Trump. And I'm a gay man, by the way. I'm a complete homosexual, and I voted for Trump 2 times, and I'm about to vote for him again. What they are doing to that man is unconstitutional, and it is wrong. And if you are somebody that hears that, and you're just, you get a weird feeling, like almost like an abrasive type, like, whoa, I'm not mad at you, but really you need to learn more about economics and the facts, and don't let either party, I don't like either of them, honey, but Trump is the realest one I've seen come along so far until at least I get up there, and I'll be up there as a gay independent, your first gay president. But let me tell you, Trump he loves this country. Do not fall for these slime ball, greasy, prostitute, puppet politicians bullshit on either party, okay? Be a student of history and economics and make your own decision. Don't just go off basically social engineering and what mainstream media is programming into your mind, okay? And I'll leave it with that. Y'all have a good night. You're welcome to email me. My email is which one should I use? hamboneproperties@gmail.com. It's HAMBONEPROPERTIES@gmail.com. I have a little Airbnb property business. But you're welcome to email me or just comment. Just comment because I don't want to get a ton of emails, okay? But y'all have a good night, and anybody who watches this, I appreciate it. I don't care if you like or follow or whatever. Just I'm not trying to do this for any reason other than I have this knowledge and I felt a call to share it. So that's it. Y'all have a good night.